Welcome to the deep dive. Today we're going to be exploring Microsoft's foray into the healthcare sector with its new AI-powered tool, Dragon Copilot. And if you're interested in this and other exciting tech developments, be sure to check out https://learnxyz.in. So this Dragon Copilot sounds pretty futuristic. What's the story here?
It's really interesting how Microsoft is building on their acquisition of Nuance, a company known for its expertise in voice recognition and ambient listening.
Okay.
They're taking those technologies and applying them to create an AI assistant specifically for healthcare professionals.
So it's not just another generic AI, it's specifically tailored for the medical world.
Exactly.
But what exactly does Dragon Copilot do?
Imagine a doctor seeing a patient as they're talking and examining. Dragon Copilot is in the background, listening and documenting everything in real time.
Wow.
It uses ambient listening and voice dictation to capture the clinical interaction, and then leverages natural language processing to translate that into accurate, comprehensive medical notes.
Hold on, ambient listening. Does that mean it's recording every word spoken in the room, even if it's not directly related to the patient's case? How does it know what to focus on?
That's a great question. It's designed to differentiate between relevant clinical conversations and background noise. It can identify key medical terms, patient symptoms, and doctor instructions to create a focused and accurate record of the visit.
That's impressive. So it's not just recording, it's understanding the context and filtering out irrelevant information.
Right.
But how does it handle complex medical terminology? Medical jargon can be pretty dense.
Dragon Copilot has been trained on a vast amount of medical data and literature. It can recognize and accurately interpret complex medical terminology, drug names, diagnoses, and treatment plans. It's like having a medical expert built into the system.
That's amazing. It sounds like this could be a game changer for doctors who are often bogged down by paperwork.
Yeah.
Less time spent on documentation means more time for patients, right?
Right. Exactly. That's one of the key promises of Dragon Copilot, to reduce administrative burden and free up clinicians to focus on what matters most: patient care.
Okay, I see the potential here. But beyond taking notes, what other tasks can Dragon Copilot handle?
Well, think about all the administrative tasks that take up a doctor's time. Dragon Copilot can automate things like generating referral letters, creating after-visit summaries for patients, even pulling up relevant clinical evidence to support treatment decisions.
It's like having a super efficient assistant who never takes a break.
Precisely.
Wow, that's a lot more than I initially imagined. It sounds like Dragon Copilot could potentially impact everyone involved in healthcare: doctors, nurses, administrative staff, and even the patients themselves.
You're absolutely right. By streamlining workflows and improving efficiency, it could have a ripple effect through the entire healthcare ecosystem.
Let's talk about the impact on doctors first. I know burnout is a huge issue in the medical field. Could Dragon Copilot help alleviate some of that stress?
Absolutely. One of the leading causes of burnout among physicians is the overwhelming amount of administrative work they have to deal with by automating those tedious tasks. Dragon Copilot could significantly reduce their workload and allow them to focus on what they went into medicine to do: care for their patients.
So it's not just about saving time, but also about improving the well-being of healthcare professionals. That's a big win. But what about the patients? How does Dragon Copilot benefit them?
Think about it this way. When doctors are less stressed and have more time to devote to each patient, the quality of care naturally improves. Patients are more likely to feel heard, understood, and cared for. Plus, Dragon Copilot can help ensure accurate record keeping, which means fewer medical errors and better informed treatment decisions.
So happier doctors lead to happier patients. Makes sense. But I'm curious, how do you think Dragon Copilot will change the dynamic between doctors and patients during a visit?
That's a fascinating question. With the AI handling the documentation, doctors can be more present and engaged in the conversation. They can make more eye contact, listen more attentively, and really focus on building a rapport with the patient.
It's almost like Dragon Copilot is removing a barrier between doctor and patient, allowing for a more human connection.
Exactly. It's about shifting the focus from data entry to human interaction, from treating symptoms to understanding the whole person.
Okay, I'm seeing how this could be really transformative, but let's talk about the financial side of things. Is this a costly investment for hospitals and clinics, or could it actually lead to cost savings?
Well, that's where things get really interesting on the surface. There's the cost of implementing and maintaining the technology, but when you consider the potential cost savings, the picture becomes much more compelling.
You mean like reducing the need for medical scribes or transcription services?
Exactly. Hospitals currently spend a significant amount of money on those services. Dragon Copilot could automate a large portion of that work, leading to substantial savings, and that's just the tip of the iceberg.
Okay, I'm intrigued. Let's break down this potential savings. Give me the numbers.
Let's start with medical scribes. A medium-sized hospital employing over 50 scribes could easily spend $2 million to $3 million annually on those services with Dragon Copilot. The reliance on scribes could be reduced by 50 to 70%, saving them a substantial amount each year.
Wow, that's a lot of money. And what about transcription services? I know those can be expensive as well.
You're right. The average cost per dictated minute for transcription is somewhere between 7 and 25 cents. If the doctor dictates for about 2 hours a day, that's roughly 120 minutes now. If a hospital has 100 doctors switching to Dragon Copilot, could save them anywhere from $306,000 to $1.1 million annually on transcription costs alone.
Okay, so we're talking about major savings on administrative costs. But are there any potential revenue increases we should consider?
Absolutely. One of the biggest benefits of Dragon Copilot is its ability to free up doctors' time. Physicians often spend 20 to 40% of their time on documentation. By automating that they can see more patients, imagine if a doctor could see even 2.5 more patients per day because of the time saved that could boost a hospital's annual revenue significantly.
That's a compelling argument, but wait, there's more, right? What about the financial impact of physician burnout?
Your sharp physician burnout is a huge problem, leading to high turnover rates, which cost hospitals a fortune in recruitment and lost productivity. If Dragon Copilot can reduce burnout and lower turnover by even a small percentage, the financial benefits could be substantial.
It seems like we're just scratching the surface of the potential financial impact of Dragon Copilot. Before we get too carried away with the numbers, let's talk about the cost of implementing this technology. I imagine it's not exactly cheap.
You're right. While the exact pricing hasn't been officially announced, we can speculate based on similar AI tools.
So hospitals would need to factor in subscription fees, integration costs, staff training, and potentially even hardware upgrades.
Exactly. It's crucial for healthcare institutions to conduct a thorough cost-benefit analysis before jumping on board.
That's a good point. But considering the potential savings and revenue increases we've discussed, it seems like a worthwhile investment, especially when you factor in the positive impact on doctor well-being and patient care.
I agree. It's not just about the bottom line. It's about creating a better healthcare system for everyone.
Now, I know this technology is still relatively new, but are there any early indicators of success? Any case studies we can look at?
Well, Dragon Copilot is just getting started, but we can look at the success of Nuance's Dragon Medical One, which was already implemented in many healthcare settings and showed significant improvements in documentation efficiency and accuracy.
So it seems like Dragon Copilot, with its combined capabilities, has the potential to truly revolutionize the way healthcare operates.
Absolutely. It's not just about automation. It's about creating a more efficient, patient-centered healthcare system where everyone benefits.
This has been a truly fascinating deep dive into the world of Dragon Copilot. But before we move on to some more exclusive insights about this innovative tool, let's pause here. Be sure to visit https://learnxyz.in to delve deeper into the world of Dragon Copilot, and other game-changing technologies will be back soon to unpack even more fascinating details about this potential healthcare revolution. Welcome back to the Deep Dive. We've been exploring the ins and outs of Microsoft's Dragon Copilot. Before we jump back in, I want to remind you to visit https://learnxyz.in for more insights into this groundbreaking technology and other fascinating tech advancements now. Before the break, we were discussing some of the potential cost savings and revenue increases that Dragon Copilot could bring to healthcare. But what about the nitty-gritty details? How does it actually work in practice?
It's all about seamless integration and intuitive design. Think of Dragon Copilot as an extension of the doctor's workflow. It's designed to be user-friendly and unobtrusive, allowing clinicians to interact with it naturally using their voice.
So a doctor could be examining a patient, talking to them, and Dragon Copilot would be capturing all of that in the background.
Precisely. It uses a combination of ambient listening and voice dictation to create a comprehensive record of the clinical interaction, and because it's powered by advanced natural language processing, it can understand and interpret complex medical terminology.
You mentioned natural language processing a few times. Can you explain that a bit more for those who might not be familiar with the term?
Sure. Natural language processing, or NLP, is a branch of artificial intelligence that focuses on enabling computers to understand, interpret, and generate human language. In the case of Dragon Copilot, NLP allows it to accurately transcribe spoken words, recognize medical terms, and extract relevant information from the conversation.
So it's not just about capturing words. It's about understanding their meaning and context within a medical setting that's impressive. But what about accents and dialects? Can Dragon Copilot handle variations in speech patterns?
That's a great question. Dragon Copilot has been trained on a massive data set of diverse voices and accents, making it highly adaptable to different speech patterns. It can accurately transcribe even heavily accented speech, ensuring that everyone's voice is captured and understood.
That's really important for ensuring inclusivity and accessibility in healthcare.
Yeah.
Now let's talk about multilingual support. We touched on this earlier. But can Dragon Copilot really handle multiple languages effectively?
Absolutely. Multilingual support is one of Dragon Copilot's key strengths. It can transcribe and translate medical conversations in real time, allowing doctors and patients who speak different languages to communicate seamlessly.
Wow, that's like having a universal translator for the medical world. I can see how that would be incredibly valuable in today's increasingly diverse patient populations. But what about patient privacy? With all this listening and recording going on, how does Dragon Copilot ensure that sensitive medical information is kept confidential?
That's a critical concern, and Microsoft has taken extensive measures to ensure patient privacy. Dragon Copilot adheres to all relevant healthcare privacy regulations, like IPA, and uses robust encryption to protect patient data.
So patients can rest assured that their conversations are not being recorded and stored in some giant database somewhere.
That's correct. The focus is on using the data to improve the patient's care in real time. It's not about storing or sharing personal information without consent.
That's reassuring to hear. Now, let's shift gears a bit and talk about the impact of Dragon Copilot on medical education and training. How do you see this technology influencing the way future doctors are taught?
That's a fascinating area to consider. Dragon Copilot could be a valuable tool for medical students and residents. Imagine them using it to observe and analyze real-time doctor-patient interactions, to practice their documentation skills, or even to receive feedback on their clinical reasoning.
It's like having a virtual mentor who can provide insights and guidance at every step of the learning process. That's pretty cool. But let's not forget about experienced doctors. Could Dragon Copilot help them stay up to date with the latest medical advancements?
Absolutely. Dragon Copilot can be integrated with medical databases and research journals. It could alert doctors to new studies relevant to their patients' conditions, provide summaries of the latest clinical guidelines, or even suggest alternative treatment options based on the latest evidence.
So it's not just about automating tasks, it's also about empowering doctors with knowledge and insights. That's a powerful combination. But with all this talk about AI and automation, some people might be wondering if Dragon Copilot is going to replace doctors altogether. What are your thoughts on that?
That's a common concern, but I think it's important to remember that AI is a tool, not a replacement for human expertise. Dragon Copilot is designed to augment doctors' abilities, not to replace them. It can handle the routine tasks, freeing up doctors to focus on the complex aspects of patient care that require human judgment, empathy, and intuition.
So it's about collaboration, not competition.
Well, Lacey, it's about finding the right balance between AI and human intelligence to create a healthcare system that is both efficient and compassionate.
I love that. Now, we've talked a lot about the potential benefits of Dragon Copilot, but I think it's important to acknowledge that there might be some challenges and limitations as well. What are some of the things we need to be mindful of as this technology rolls out?
One important consideration is the potential for bias. AI systems are only as good as the data they are trained on if the training data is biased. The AI system could perpetuate those biases in its outputs. This is especially important in healthcare, where decisions based on biased information could have serious consequences.
That's a crucial point. So it's essential to ensure that the data used to train Dragon Copilot is diverse and representative of all patient populations.
Absolutely. We need to be vigilant about identifying and mitigating potential biases in the training data to ensure that Dragon Copilot is a fair and equitable tool for all patients.
I think another challenge is ensuring that healthcare professionals are adequately trained to use this technology effectively. It's not just about knowing how to turn it on and off, it's about understanding its capabilities, its limitations, and how to integrate it into their workflow in a way that benefits both them and their patients.
I agree. Training and education will be key to the successful implementation of Dragon Copilot. Doctors and nurses need to feel comfortable using this technology and confident in its ability to support their work.
I imagine there will also be some initial resistance to change. Many healthcare professionals are accustomed to doing things a certain way, and adopting a new technology can be disruptive.
That's true. Change management is always a challenge, especially in a field like healthcare, where traditions and established practices run deep. But I think the potential benefits of Dragon Copilot are so compelling that with the right approach, we can overcome those initial hurdles.
I'm optimistic as well. It's clear that AI is transforming the healthcare landscape, and tools like Dragon Copilot are at the forefront of that transformation. It's an exciting time to be witnessing these advancements and to consider the possibilities they hold for the future of healthcare.
I couldn't agree more. It's a privilege to be a part of this evolution and to contribute to creating a healthcare system that is more efficient, equitable, and patient-centered.
This has been another fascinating segment of our deep dive into Dragon Copilot, but we're not done yet. We'll be back after a short break to explore some of the more intriguing aspects of this technology and to discuss its long-term implications. Stay tuned. Welcome back to the deep dive. We've been exploring the intricacies of Microsoft's Dragon Copilot and its potential to transform healthcare. Remember, you can find more in-depth information on this and other cutting-edge technologies at https://learnxyz-in. Now, before the break, we were discussing some of the challenges and considerations surrounding AI in healthcare. One thing that struck me is the potential impact on the doctor-patient relationship. Do you think Dragon Copilot could actually enhance that connection?
It's an interesting paradox, isn't it? We often think of technology as creating distance between people, but in the case of Dragon Copilot, it could actually bring doctors and patients closer together.
Oh, so?
By handling those time-consuming administrative tasks, Dragon Copilot frees up doctors to be more present and attentive during patient visits. They can focus on listening, empathizing, and building a genuine rapport.
It's like removing those digital distractions that often get in the way of meaningful human interaction. Doctors can put down their tablets, make eye contact, and really engage with their patients on a personal level.
Exactly. It's about shifting the focus from data entry to human connection. Imagine a doctor who can truly listen to their patients' concerns without the pressure of simultaneously typing notes or checking boxes in an electronic health record.
That sounds like a much more satisfying experience for both the doctor and the patient. But what about the patients themselves? Do you think they'll be comfortable with an AI listening in on their conversations with their doctor?
That's a valid concern, and transparency is key. It's essential to inform patients about how Dragon Copilot works, how their data is protected, and how it ultimately benefits their care when patients understand the value and the safeguards in place. I think they'll be more likely to embrace this technology.
I agree. Open communication is crucial for building trust and ensuring that patients feel empowered in their healthcare decisions. But let's zoom out a bit and consider the broader implications of Dragon Copilot. Do you think this technology could help address some of the systemic challenges facing healthcare today?
Absolutely. One of the biggest issues in healthcare is access to quality care. There's a shortage of doctors in many areas, and wait times for appointments can be incredibly long. Dragon Copilot could help alleviate some of that pressure by increasing efficiency and productivity.
So doctors can see more patients in the same amount of time, reducing wait times and improving access to care. That's a significant impact. But what about the cost of healthcare? It's no secret that healthcare costs are skyrocketing. Could Dragon Copilot play a role in making healthcare more affordable?
That's a complex issue, but I think Dragon Copilot could contribute to cost savings in a few ways. First, as we discussed earlier, it can reduce the need for expensive medical scribes and transcription services. Second, by improving documentation accuracy. It can help prevent billing errors and claim denials, saving healthcare providers money. And finally, by enhancing preventative care and early detection, it could potentially reduce the need for costly interventions down the line.
Those are all valid points. It seems like Dragon Copilot has the potential to create a ripple effect of positive change throughout the healthcare system, from improving access to care to reducing costs and enhancing patient outcomes.
Right.
But let's talk about the future. What are your predictions for the evolution of AI in healthcare in the coming years?
We're just at the beginning of this AI revolution in healthcare. I think we'll see a rapid acceleration of innovation in the coming years. We'll see even more sophisticated AI tools that can assist with diagnosis, treatment planning, and personalized medicine.
Personalized medicine, that's an exciting concept. Can you elaborate on that a bit more?
Yeah. Imagine a future where AI can analyze a patient's genetic information, lifestyle factors, and medical history to create a truly personalized treatment plan. It could identify the most effective medications, predict potential risks, and even suggest lifestyle changes to optimize their health.
That sounds like science fiction, but it's incredible to think about the possibilities. It seems like AI is moving us towards a future where healthcare is more precise, proactive, and tailored to the individual needs of each patient.
I agree. It's a future where we can move beyond a one-size-fits-all approach to healthcare and embrace the unique needs of each person.
But with all these advancements, we need to be mindful of the ethical considerations as well. What are some of the potential risks or challenges we need to address as AI becomes more integrated into healthcare?
One crucial consideration is ensuring that AI is used responsibly and ethically. We need to establish clear guidelines for data privacy, algorithmic transparency, and bias mitigation. We need to ensure that AI is used to enhance human capabilities, not to replace them.
It's about striking the right balance, isn't it? Using AI to improve efficiency and accuracy while preserving the human touch that is so essential to compassionate care.
Absolutely. It's about creating a healthcare system that leverages the best of both worlds, human expertise and technological innovation.
This deep dive into Dragon Copilot has been incredibly insightful. It's clear that this technology has the potential to revolutionize healthcare, and I'm excited to see how it unfolds in the coming years for those who want to delve deeper into the world of Dragon Copilot and other healthcare advancements. Be sure to visit https://learnxyz.in. And before we sign off, don't forget to like this video and subscribe to our channel for more fascinating deep dives into the world of cutting-edge technology. Thank you for joining us.